Hello, and welcome to another session in our Science on the Seventh series, the monthly live stream where we speak with global experts on topics related to air pollution and health. Today, I'm very excited to welcome Dr. Karadi Wright, who is the Chief Specialist Scientist at the South African Medical Research Council and works on a wide range of topics related to air pollution, climate change, and health. Welcome, Karadi. I'm also very excited to welcome Dr. Alice Caudia, who is a senior environment expert and Africa advisor at the Climate and Clean Air Coalition. Welcome, Alice. I'm really glad to have you both join us today, especially as the of Parties or the COP meeting begins in Egypt, talking about air pollution, climate change, and more. And I'm hoping that we can speak over the next few minutes about air pollution in Africa. As you both know, we just recently released a State of Global Air report looking at trends in air pollution and health in Africa that tells us that more than 1 million people died as a result of air pollution exposures in Africa in 2019 alone, massive health impacts in countries across the region. But what I would like to maybe start off with is this map that we also had in the report, which shows us what the PM 2.5 levels are. So if we can pull up that map, we see lots of reds really indicating higher exposures to PM 2.5. So these are all countries which have PM 2.5 levels or of 15 or more. And Kardi, if I can begin with you, what really makes Africa unique in its air pollution and health story? Where are we? What are the important considerations?
Thanks, Pallavi, and great to be here with you and with Alice. So what makes Africa special when it comes to air pollution challenges and the impacts that those air pollution challenges have on health is that there's a very big mix of both ambient air pollution and household air pollution. So the ambient air pollution sources would be ranging from industry, coal-fired power stations, transport, background dust. Africa is a dusty continent, and other types of outdoor sources. But then we have a very large component that comes from the burning of solid fuels, especially for cooking in households where there's non-electrification. And even, in fact, in households where there is electricity, but people jump up and down the energy ladder depending on what they have available to them at the time. When all of this together means that we have a very diverse range of air pollution sources and potential exposures across the African continent.
Yeah, that's such an important point that we have this huge mix of sources. And Alice, if I can turn to you, I know the Climate and Clean Air Coalition and UNEP have conducted a broad analysis which looks at the science and what it can tell us for fast tracking action on climate and air pollution. And as the world's leaders meet and talk about action on climate over the next few days, what is it that we're learning so far in terms of action that we need, especially in the context of Africa? Alice, I think you are muted.
Thank you. Sorry. Thank you very much, and I'm delighted to join you in this show. The Africa Integrated Assessment on Air Pollution and Climate Change was undertaken in the context with a vision of addressing the Africa's development blueprint, that is Africa's Agenda 2063, tied up to the Paris Agreement and the Agenda 2030 development aspirations. And the assessment really showed that air pollution is a major risk factor in Africa, and that as a short-run measure intervention, reducing short-lived climate pollutants like methane, black carbon, nitrogen dioxide, and so forth, can have huge health benefits to the continent, as well as to other health-supporting activities like crop production. So overall, the assessment shows that reducing these pollutants can provide benefits to the society economically, environmentally, and socially. The other lesson that we learned is that a lot of premature deaths associated with the indoor air pollution, as Karidi has just said, is really for the children. And this, in my experience, is associated with the way we in Africa use solid fuels in houses or dwellings that are really poorly structured to encourage a good flow of air within. And the children spend a lot of time with their mothers in the kitchen. So this is there is evidence that we need to address the impact of air pollution on children, women, and but people with special needs in Africa.
Yeah, thank you. Thank you so much for highlighting those. I think, household air pollution and the use of solid fuels is such an important source. It's not just relevant indoors, but even, in many places, it can contribute to outdoor air pollution. And I have been struck by some of the numbers and figures we have on the impact of air pollution on children's health. So if I can pull up just an image of how air pollution impacts people's health across age groups. I think we have one for South Africa. And, I know people are looking at this. There's lots of numbers here. What I want you to focus on is on the very left side, you'll see this big bar. The green here represents the contribution from outdoor air pollution or ambient PM 2.5. The orange is the household air pollution. So notice the big bar for children under 28 days. So these are really the newborns, and then also large impacts in people over the ages of 50. If we switch over to Kenya now, looking at the same figure, so green is ambient PM 2.5, orange is household air pollution. We again see a really big bar, but notice how much of the contribution is coming from household solid fuel use. Exactly, Alice, is what you were talking about. And we know across Africa, more than 200,000 newborns die as a result of their mothers getting exposed to air pollution during pregnancy. Karidi, I know you do research on this topic, so you look at numbers like these and data like these a lot of times. How are countries really thinking about, improving children's health, and where does air pollution figure in all of those efforts?
Yeah, so it's certainly interesting to look at those statistics for South Africa and for Kenya, particularly for infants that are really very young. We've got to bear in mind that some of the consequences of those exposures would be what happened in the womb. So we know that there is an association between air pollution exposure of a mum who's pregnant and congenital birth defects, unfortunately. And so some of those deaths in those very young infants could be a consequence of what happened in the womb. But of course, then we are concerned with the exposure of the child or the infant when they are with the mum in those very early days, whether it is the ambient exposures that we are seeing in South Africa or the household exposures. We have to bear in mind that children are small, so their breathing rate to body ratio means that any exposure to air pollution really is very intense in their body. And we know that, for example, particulate matter can cross into the blood and into the brain. And these have long-term effects as well on children and their growth. It can affect stunting, for example, as well as have cognitive effects on children later in life. So countries have to deal with both the ambient and the household air pollution sources. The ambient sources are usually dealt with through regulation, policy, legislation, and enforcement of compliance to national ambient air quality standards or regulations based on the industrial type. It's a bit more tricky when it comes to the household air pollution. So here, usually environmental health officers and community health workers would be trying to raise awareness among mothers to ensure that their children are not exposed to a very smoky house or dwelling environment. But this is difficult when a person doesn't have choice. So essentially, as a country and even as regions, we'd need to be thinking about how to make household air pollution less of a risk to infants and to children, and of course to women, by improving access to clean electricity, so renewable energy sources to generate electricity to avoid air pollution in the breathing zone in households.
Thank you, Kardi. I think you raise a number of really important points. And I really like the emphasis on clean energy and clean electricity and increasing access to people. Alice, we know you've worked with a range of groups over your career thinking about action to address air pollution. And we know we need to act on air pollution at multiple levels, at the city level, at the country level, and at the regional level. And sort of drawing from your personal experience and also from the experience of this large assessment, the Africa assessment that was done in collaboration with the African Union Commission, what what is it that we need to be focusing on? What kind of actions do we need to think about? What kind of actions are countries and cities in Africa already think about? And where might be some gaps that we still need to fill?
Yeah, thank you very much. I think with respect to action that needs to be taken at multiple levels, including cities, we take note that air pollution affects people differently depending on their age, gender, socioeconomic status, and geographical location. And that's a strong lesson that has come from the assessment. And at the continental level, we find that there is huge effort to steer Africa to develop in a climate resilient manner with low emissions. And those general overarching policies are captured in, for example, the Africa's Climate Change Strategy and Action Plan for the period 2022 to 2032. That's a 10-year period. We also have the Africa Green Recovery Program. And you find that overall, the continent is moving towards a paradigm shift on development approach. You find conversations around green growth, green economy, circular economy, sustainable consumption and production being spelled out in policies and action plans. But what should they really, really do? I think moving from policy to action is a major hurdle for Africa, particularly because of limited resources, technology, and capabilities. And I think in the case of air pollution management, we need to ensure that we have very strong infrastructure for data collection and management. I mean, we can't plan without accurate data. We can't plan without sound scientific information and knowledge. And therefore, we need to look at management of air pollution and climate change in an integrated manner, and more so to anchor it on scientific basis and scientific evidence. But that requires cooperation and collaboration across all sectors and across the whole economy. I think when I
think we may have lost Alice temporarily, and hopefully she will be back with us soon. Kardi, while we're waiting for her to join, I think Alice was making a really crucial point about a paradigm shift that is happening. And I know in South Africa in particular, there has been a major new policy that was adopted around just transition. So trying to think more holistically about energy solutions than just where the energy comes from. Can you tell us a little bit more about how that came about and what it really entails, and where you see this helping with air pollution work in addition to climate change.
Yeah, sure. So the Presidential Climate Commission grew from the request of the President of South Africa. And this follows the process of working towards a climate change bill and eventually a climate change act. So this commission was brought together to consider ways in which South Africa will be able to transition to working in a space where there's clean energy for all. So in other words, energy that's generated from clean sources, moving away from coal-fired power stations, which we know both contribute towards climate change as well as air pollution. So the just transition, or what they're now calling the transition without the just transition, and we usually refer to it as the just energy transition, has become somewhat larger because they're seeing it as an opportunity to grasp many of the developmental aspects that are greatly needed in our country to see people's livelihoods advance, to improve skills, to upscale and build capacity among people, so that they can we can improve our unemployment rates and see new opportunities out of this transition away from the use of technically dirty fuels that is polluting so many parts of our country.
Yeah, I think that is, very interesting, and it will be great to see how this develops over the next few years, because some of these choices are absolutely also going to impact air quality levels and, health impacts that are associated with them. And I think we're seeing this more and more in different countries, because even in India, where there's large communities which are absolutely dependent on coal for livelihood, for healthcare, and many other things, we're starting to see this conversation. So I think we need to closely follow what happens in South Africa and elsewhere. And Alice, if I can come back to you, you were telling us a little bit about, resource gaps that might exist and data gaps might exist. Where do you see a path forward on action on air pollution?
I think we need to have regional collaboration in a south-south, north-south system, so that we can improve on the quality of data that we gather. But I also want to get back to Candy's conversation about energy transition. And this has been my experience in the African continent. That we recognize that household air pollution is really a key risk factor, and many deaths occur out of that because of high dependence on solid fuels and inefficient cook stoves. However, governments also have good policies, but these policies don't reach the beneficiaries, the actors, the households. And even if they do, the tricky bit about household air pollution is that it also borders on an attitude and perception. And poverty is a key underpinning challenge for households to move from cleaner fuels. So we need to craft systems that can public education and awareness and advocacy they're the soft aspects of our actions that should be strengthened, so that we don't just rely on scientific hard information that has come. Yes, we know 1.1 million people are dying prematurely out of air pollution in Africa. However, what can we do about it? We need to integrate natural science, social science, behavioral science, so that we work on a platform that enables those who are really impacted negatively, the poor, the women, the children, to have information on the importance of breathing clean air.
Absolutely. I think, that this is like a crucial point that we continue to come back to. How do we really go from what we know to what, needs to happen on the ground? And if I can turn back
Could
for a
I can just before you turn back, what I also note, I know we'll handle this later, time permitting, but we also appreciate what African countries have done. You see, on the climate change space and negotiations, African countries have come in with extremely ambitious targets on emission reductions, but they don't have that internal capacity to undertake this. Some of the programs we read are very encouraging, very promising, but getting them done is really constrained by limited technology, finance, and internal capability.
Completely. And thank you so much for raising this point, because it actually connects with what I was about to ask you as well. We know that there are data gaps, we know that there are resource gaps, but we also know that there's a growing number of both individuals and organizations across the continent that are focusing on air pollution, that are focusing on energy, that are focusing on climate and health. And just in the last few years, we've seen several regional collaborations begin to form. There's now an Africa Society for Air Quality. There's an atmospheric group and Africa Group on Atmospheric Sciences. The African Academy of Sciences is starting to pay attention to air pollution. And even the Africa Assessment that you both were a part of brought together a large group of scientists from across the continent. And I wonder if you can reflect on, how some of those collaborations and regional efforts are growing, and perhaps give us some positive examples of where we are starting to see some action, starting to see some change, maybe filling some gaps based on your experiences. Karadi, do you want to go first?
Yeah, so I agree. I think that we have much still to do, but we should also stop and pause and reflect on some of the good efforts that are being done. So, all the researchers and not only researchers, but policy people from the World Health Organization and other large bodies, the United Nations, for example, gathered to put together the latest evidence that we could, as well as really brainstorm to think of what are the innovative, practical, feasible, but also a bit ambitious things that we can do to try and solve the air pollution and linked climate change challenges on the continent. And I think what we're seeing more and more through those types of reports is life's all about relationships, really. And if people who know each other now exist in these different spaces and different regions, they can work together. So I found it extremely useful to meet people from different regions of Africa through working on these reports, who I can now collaborate with on research proposals, for example, to get funding to test and implement new interventions around clean cook stoves, for example. So just the networking that's gone on through not only just academia or researchers, but with the right policymakers. I was in a meeting recently where we were fortunate enough to have a person from the actual government space in the meeting who could speak to, well, what are we going to do to translate what you're talking about from science into an actual on-the-ground actionable step that we can take? And I found those connections, networks, and relationships very inspiring for how we're going to move forward on the African continent to solve these problems.
That's, definitely encouraging. And I think I would completely agree with you. Being connected with people is often the very first step to forming relationships and then thinking about what can be done. Alice, would you like to add your reflections on this as well?
Yeah, actually, for me, the undertaking of the Africa Integrated Assessment on Air Pollution and Climate Change was structurally very innovative. Innovative in the sense that it was anchored on a decision by the African Ministerial Conference on Environment. Therefore, it already has a government commitment, a commitment by different governments in the African continent. And as Karidi has already said, the idea of having these so many scientists from the continent engaged was very, very innovative indeed. What I see is also the commitment of the African Union Commission. You see, the way we are structured in Africa policy-wise, the member states of African Union Commission depend on the decisions at that level to inform country-level processes. So as it is, the assessment generating 37 clean air measures across 5 sectors, that is agriculture, waste, industry, household energy use, and transport. And all this drawn from ambitions already stated in countries' nationally determined contribution commitments to the UNFCCC, tied everything together. And you find that given that air pollution is really unique, like climate change, it does not respect, I mean, it's just transboundary international challenge that does not respect the socioeconomic status of anybody. If the air is dirty, it's dirty for all of us. It means we all need to take action. So what we are seeing is a lot of interest even coming through from philanthropic organizations, from the private sector, from the NGO sector, working on management and prevention of air pollution. So it's encouraging. In our case, as we worked through, we found that through networks of Climate and Clean Air Coalition, which is a member organization, we have been able to cluster scientists around these 5 sectors so that action can be taken at the country level. We also, in the structure of the process, got ministers of environment to appoint focal points of the assessment. These are nationals who will now focus not only, but focus a lot of their technical effort on managing air pollution and climate change in an integrated manner.
Yeah, I think those are all, very, very important steps. And I really hope that even as the assessment comes to a close and is formally released, some of those connections and those networks can continue on, because we're really relying on those to continue to make progress. I do have one final question for both of you. Some of our colleagues are in Egypt right now at the COP meeting, where they're pushing for more action on climate change and making health a more integral component of our climate change actions. And in the African context, as both of you have highlighted already, many countries are doing a lot. There may be gaps in how that can be, really completed in terms of resource and technical access, but the ambition is there, and that's very, very encouraging news. So as you look at the COP meetings in Egypt, what are you hoping that the countries will come out of this and say, and where do you think the conversations should follow next, so that we can continue to make these improvements in both air pollution and air quality, I should say, and also improving people's health? Alice, would you like to go first?
Oh, thank you very much. I think I read the position paper by the African Group of Negotiators, and it's very encouraging, more so when they focus on the fact that Africa needs to focus on adaptation, resilience, and innovative approaches to tackling climate change. But I think my expectation really, as a practitioner, as a policy person, is that we move from conversations to action. And that's why it's very encouraging that the African Union has this climate change strategy and action plan. The key word there is action, so that we see what can we do to build resilience, to enable adaptation, to prevent loss and damage from climate change. And with respect to air pollution, actually take action to ensure that the highly polluting sectors are managed to minimize pollution, whether ambient or indoor.
Yeah, thank you. I think that's a clear, good ask. Karadi, what are you hoping for?
Yeah, so I'm really hoping to see recognition that health is at the core of this conversation. I think we've not seen that. I see the WHO, World Health Organization, has a pavilion and a number of side events ready to try and create a big splash to ensure that health is really made known, that it is the impact on health, both from climate change and from air pollution, that we should really be worried about, and how we're going to solve it. I'd also like to see some very strong commitment to action, as Alice was saying. But in order to make that happen on the African continent, we have to give serious thought to the financial considerations in how we can implement the interventions, whether they are adaptation or mitigation. The financial component is a very big concern, and something that I'd like to see taken very seriously this year, as well as a big focus and understanding of the consequences of human health from both climate change and air pollution on the African continent.
Yeah, well, I think the financial discussion is often the one of the key barriers to action. So I really hope that both our leaders and our colleagues who are there to convince our leaders are able to make progress on this issue. As we've discussed here and as we've known through other work, air pollution is really an important contributor to people's health across Africa. And a lot of energy decisions could impact how people's health is affected over time. I hope we can continue some of these conversations and see how we can take them from conversations to action in each country across the region and around the world. But for now, I would like to thank you both for taking time to join us today from South Africa and from Kenya. And we really hope that we will keep this conversation going, and we will keep the momentum up for cleaning the air and making people breathe healthier. Thank you very much, Alice and Karadi, again. And to those of you who are listening to us, thanks a lot for joining in. You can watch all of our previous sessions on our website, and please do not forget to join us on December 7th, when we'll welcome Dr. Maria Neira from the World Health Organization and Jane Burston from Clean Air Fund to reflect on all things air pollution as we close 2022. Thank you very much.